So one of the things that any visitor to our current emergency room would probably notice is we struggle to mm, maintain a level of care that other emergency rooms are currently giving. A couple examples are some of our rooms are just too small, and it's difficult to move in all of our equipment, like say an ultrasound machine, without having to ask family members to step out of the room or move furniture like chairs. And in some settings, that's a real hassle. Um, there are some other rooms which, when they were created 30, 40 years ago, were fantastic in their day, but basically are shared rooms, and it's very difficult to have confidential or important, crucial conversations with family members, knowing that there might be a 3-year-old and some other family member just beyond a curtain who can hear all of that. We've been laboring under that difficulty for more than 20 years, and our patients deserve confidentiality and privacy, but they also deserve space and just the comfort to be able to have a loved one or a family member back in the room with them, that's not limited simply by space. So the new facility answers all of those difficulties. There's a real economy of space. All of the rooms are fairly uniform or very generous in size, and secure a certain level of privacy and comfort for the patients that we simply are long overdue to provide and that we just can't administer in our current facility. So we're really looking forward to that. The medicine that I'm practicing today is really different than the medicine that I practiced 20 years ago. And and medicine is going to continue to change. And I think one of the trends that we're seeing is so much more is being done in what's considered the outpatient setting. So any procedures, tests, things that we can do in the emergency room to help keep patients healthy, but also to prevent them from deteriorating and being required to be in the hospital overnight. I think our ability to render that care is definitely going to be improved in this new facility. It'll certainly be handy to have all of Unity Point's services combined under one roof. So if I need to coordinate with MRI or CT imaging, that's going to be much easier to do than it is right now. I think our ultrasonographer capabilities are going to just be much easier to accomplish in the room. So instead of having patients leave and come back for a different test or maybe leave the department, I think we're going to be able to, for their comfort, accomplish a lot more right in their room. And we really have a great difficulty doing that, mainly because we're limited by space right now. You know, when you practice emergency medicine, it gets under your skin, and it's something I'll probably do until they tell me I can't do it anymore. and But I think that to know that Unity Point and Marshalltown value emergency care and the care that my department provides enough to raise the standard and quality that we are able to give really is meaningful to me. It sort of validates the work that our department does. And I don't want to say that I necessarily need that, because I get to be a hero to some patient almost every shift. And that for me is usually the jam on the bread. But knowing that we're going to be able to simply raise the standard of care that we're providing and that other people also think that's important, I think that's why this hospital is meaningful to me.